Hello, I'm Dr. Ravi Jain, and in this video I want to explain something that almost every patient asks me about in clinic. Why does skin start to lose firmness, bounce and structure as we get older? Because aging skin is not just about wrinkles, it's not just about a bit of dryness, and it's definitely not simply about getting older. What is really happening is that the architecture of skin is changing. Two of the most important proteins involved in this process are collagen and elastin. Collagen gives your skin strength, firmness and support. Elastin gives your skin its ability to stretch and then spring back. So when a patient says to me, my skin feels thinner, or my face is starting to sag, or my skin doesn't bounce back like it used to, what they're often noticing is the gradual decline of both collagen and elastin. And the important word there is gradual. Skin aging does not happen overnight. It's a result of several biological and environmental processes happening at the same time, year after year after year. So in this video, I'm going to explain why collagen and elastin decline, what speeds up that process, and most importantly, what can we realistically do about it? Because once you understand the biology, it becomes much easier to make sensible decisions about skincare, sun protection, and treatments. So let's start with collagen. Collagen is not a fixed structure that just sits in the skin forever. Your body is constantly breaking down collagen and also rebuilding it. When we are younger, that balance is usually in our favour. We make enough new collagen to maintain the skin's firmness and resilience. But as we age, that balance starts to shift. The breakdown of collagen begins to exceed the production of new collagen, and that is when the skin starts to become thinner, weaker, and less supported. You may start to notice fine lines, looser skin, deeper folds, a less defined jawline, or that slightly crepey look, especially around the eyes, neck, and lower face. Now, one of the key cells involved in this process is called the fibroblast. Fibroblasts are incredibly important cells in the skin. They produce collagen, elastin, and hyaluronic acid. So, you can think of fibroblasts as the skin's repair and production team. When they are active and healthy, they help maintain skin thickness, elasticity, hydration, and structure. But with age, fibroblasts become less active. There are also fewer of them, and the ones that remain often become less responsive. So even if the skin receives a signal to repair itself, the fibroblasts may not respond as strongly as they once used to. And that is one of the reasons why younger skin heals more quickly, while older skin may heal more slowly and produce less new collagen after injury or inflammation. This is also one of the reasons why collagen-stimulating treatments need time. When we use treatments such as microneedling, radiofrequency microneedling, laser resurfacing, or biostimulators, we are not simply adding collagen into the skin. We are trying to wake up your own repair system. We are encouraging fibroblasts to become more active again. But biology takes time. Collagen remodeling is not instant. It usually happens gradually over weeks and months. That is why good aesthetic medicine is rarely about one dramatic treatment. It's usually about building better skin quality over time. Now let's talk about one of the biggest external drivers of collagen and elastin damage: UV exposure. Sunlight is one of the most powerful accelerators of skin aging. And this is not only about just sunburn. Many people think that sun damage only happens when the skin goes red or burns, and that is simply not true. UVA light in particular penetrates deeper into the skin. It reaches the dermis where collagen and elastin live. And over time, UV exposure increases oxidative stress. That means it creates free radicals which damage cells, DNA, proteins, and the skin's supporting structures. And this is why people who have had a lot of sun exposure often develop leathery skin, pigmentation, redness, broken vessels, wrinkles, and laxity. And UVA damage is silent. it doesn't result in burning of the skin. It happens deep in the skin dermis, silently creating damage over many, many years without you knowing about it until it's too late. So when I talk about sunscreen, I'm not saying it just because it sounds nice or because it's part of a generic skincare routine or because I'm trying to sell you something. I'm saying it because daily sun protection is one of the most important collagen preserving treatments you can use. Sunscreen does not reverse everything, but it protects what you still have. Because once collagen and elastin have been damaged for many years, rebuilding them becomes harder. Now, the skin also accumulates DNA damage over time. Every day your cells are exposed to stress. That stress comes from UV radiation, pollution, oxidative stress, inflammation, and normal cell replication. When we are younger, the body's repair systems are generally more efficient. But with age, DNA repair becomes less effective. That means small amounts of damage can accumulate over time. And when enough damage accumulates, cells do not work as well. In the skin, that can mean reduced collagen production, slower healing, and poorer regeneration. And this is one reason why skin aging is not just a cosmetic issue, it is a biological process. The skin is a living organ, and its ability to repair itself changes with age. Another major process is called cellular senescence. Now, this sounds complicated, but the idea is actually quite simple, so let me explain. A senescent cell is a cell that has stopped functioning properly. It's not dead, but it's no longer behaving like a healthy, active cell. Some people call them zombie cells. Instead of helping repair the tissue, it can start releasing inflammatory chemicals. These chemicals can affect nearby cells and contribute to chronic, low-grade inflammation. In the skin, that can lead to poorer collagen production, more collagen breakdown, and reduced tissue quality. So aging is simply not about cells that slow down. Some cells actually become dysfunctional and start sending out the wrong signals. And this is one of the reasons why the aging process can accelerate over time. Now let's discuss inflammation. There's a term called inflammaging, and this means the chronic low-grade inflammation that tends to increase as we get older. It's not the same as having a big infection or an obvious swollen injury. It's quieter than that, but it matters. Persistent, low-level inflammation can damage collagen, impair repair, and increase oxidative stress. Over time, this can make the skin less resilient, slower to heal, and more prone to visible aging. This is why lifestyle matters. Sleep, diet, smoking, alcohol, stress, exercise, and metabolic health all influence inflammation. You cannot control every part of aging, but you can influence the environment your skin is living in. And that environment either supports repair or makes repair harder. Another important factor is glycation. Glycation happens when sugar molecules bind to proteins in the body. And when this happens to collagen, it can form substances called advanced glycation end products, often shortened to AGEs. Quite appropriate, really. These make collagen fibers stiffer and less flexible. Healthy collagen should be strong, but also flexible. Glycated collagen becomes more rigid. That means the skin can lose suppleness and become more prone to lines, stiffness, and poor texture. This does not mean you can never eat sugar again. That would be unrealistic. But it does mean that sugar, blood sugar control, and metabolic health can influence the quality of your skin over time. So this is why I often tell patients that skin aging is not just about what we put on the skin, but it's also about what's happening inside the body. Now, hormones play a major role too. For women, estrogen has a significant effect on collagen production, skin thickness, hydration, and elasticity. So around the menopause, estrogen levels fall. This leads to a noticeable change in skin quality, not just on the face, but on the whole body. Many women tell me I felt like my skin changed almost overnight. And while the biological process is more gradual than that, the visible change can feel sudden. Skin may become thinner, drier, less elastic, and more fragile. Fine lines may appear more quickly. The lower face may begin to lose support. And treatments that worked well in the past may not feel quite as effective unless the whole picture is considered. In men, hormonal decline tends to be more gradual, but men still experience changes in collagen, skin thickness, and repair capacity over time. So although the pattern may differ, the underlying biology is still relevant. This is why a good treatment plan should take age, hormones, skin quality, lifestyle, and medical history into account. It should not be a one-size-fits-all approach. There is a lot of marketing suggesting one treatment can reverse aging, or restore youth, or replace surgery. That is usually a wild exaggeration. Aging is multifactorial. So treatment has to be multifactorial too. If collagen decline, elastin damage, hormone changes, inflammation, glycation, and DNA damage are all involved, then one cream or one treatment cannot logically solve the entire problem. A better approach is layered. Protect the skin. Improve the skin. Stimulate collagen. Maintain results. Review the plan as the face changes. That is how we get natural, sustainable outcomes. And that is the philosophy behind what I call invisible aesthetics. The goal is not to make someone look different. The goal is to help the skin behave better, repair better, and look healthier. When done well, people should not look at you and think, what have you had done? They should think, you look well. So the key message is this. Collagen and elastin decline because the skin's repair systems become less efficient. Fibroblasts become less active, hormones change, inflammation increases, DNA damage accumulates, sugars can stiffen collagen, UV exposure damages the very structures that keep skin firm and elastic. That is why aging skin needs to be more than a quick fix. It needs prevention, repair, stimulation, and maintenance. So if you're noticing thinner skin, laxity, wrinkles, crepiness, or loss of firmness, the first step is not to panic. The first step is to understand what is causing it, and then you can make better decisions. Protect your skin every day. Use treatments that are appropriate for your skin and your stage of aging. Be realistic about what can be improved. And remember that the best results usually come from consistent, intelligent treatment planning, not chasing the latest trend. Thanks for watching.